Hello and welcome to Pace Hospital's podcast. Today, we are shedding light on a condition that many have heard of but few truly understand, that is umbilical hernia. Often noticeable as a bulge near the belly button, this condition can affect both children and adults and may lead to discomfort or complications if not addressed in time. Joining us today, Dr. Suresh Kumar, a highly experienced surgical gastroenterologist and laparoscopic surgeon. With years of expertise in treating abdominal wall hernias, Dr. Suresh will help us explore the ins and outs of umbilical hernias, what they are, why they occur, common symptoms, risk factors, and the best approaches for treatment and prevention.
Hi everyone, I'm Dr. Suresh Seburi, consultant surgical gastroenterologist and laparoscopic surgeon at Pace Hospital, Hyderabad City.
Dr. Suresh Kumar, thank you for joining us at Pace Hospital's High-Tech City. Let's start by understanding what is an umbilical hernia.
So before knowing about umbilical hernia, we should know what exactly is hernia. Hernia is abnormal protrusion of contents through a weakest part or a defect in the abdomen wall. Whenever the defect is located in this umbilicus region, that is navel region, it is called as umbilical hernia.
So doctor, what are the symptoms of umbilical hernia?
So most of the times the first symptom will be the swelling per se, or the lump which is seen at this umbilicus region. And apart from this presentation of swelling or a lump at the umbilical region, there are certain situations where the symptoms might differ and can tell the story of underlying complication. These could be irreducibility, strangulation, or obstruction. So irreducibility is nothing but the contents which are protruded through this defect might not reduce on their own. It is called as irreducibility. Second thing is the obstruction. Whenever the content that is herniating is the bowel or the intestine, the lumen gets obstructed or occluded. These patients can present with recurrent vomitings or pain. And third and most crucial one or important one is strangulation. Strangulation is cut off of blood supply to the part that is herniated. It's a kind of emergency situation. The patient usually present with severe pain. The changes over the skin, the herniated, the swelling, the skin over the swelling might be red, tender, and on touch it could be severe. It could elicit severe pain, and these are all symptoms of underlying complication.
Can you explain what are the causes of umbilical hernia?
Any maneuver or any circumstance which increases the pressure within the abdomen wall associated with weakness of the wall per se can cause umbilical hernia logically. So what are the conditions in which there is increased pressure within the abdomen? One important thing is obesity. Second thing is chronic cough, that who patients cough for weeks or months together, like in case of asthma or any COPD, that is disease of the lungs associated with smoking. These can cause raised intra-abdomen pressure. Third important thing is constipation. Patients in which they usually strain while passing motion, these are also at high risk of developing umbilical hernia. And next thing is the multiple pregnancies. Any woman who has history of multiple pregnancies, with multiple pregnancies, what happens is this umbilical wall weakens due to stretching. So these patients are also at increased risk of umbilical hernia, and a few other clinical conditions which can cause accumulation of fluid within the abdomen wall, like in patients with liver diseases. These patients are at risk of developing what is called as ascites, that is accumulation of fluid within the abdomen wall. These patients are at risk of developing umbilical hernia.
Dr. Suresh Kumar, can an umbilical hernia go away on its own?
Usually no. So what patients might feel as the disease being gone, that is they no longer see the swelling, is actually reduced swelling. The defect or the weakness per se stays. They are at risk of again developing the swelling. So it is usually the reduced contents and not the hernia going off, which they perceive as disease gone.
Could you explain how is an umbilical hernia diagnosed?
So any amount of suspicion, that is swelling in this umbilical region, which increases, decreases depending on the manure or the act, raise the suspicion of umbilical hernia. Whenever there is suspicion of umbilical hernia, simple ultrasound abdomen or clinical examination per se can help in confidently diagnosing umbilical hernia.
So, doctor, what are the treatment options for an umbilical hernia?
So whenever an umbilical hernia is diagnosed, the gold standard is surgery. And in what way we are doing surgery, is it open or lap, depends on the surgeon and the patient. So there are in certain circumstances where patient might not be fit for an anesthesia, in those circumstances to avoid any unforeseen complications. So gold standard of treatment in umbilical hernia is surgery only, and especially among the surgeries, laparoscopic repair of the umbilical hernia has come in a big way.
Can you explain how is umbilical hernia surgery performed?
So like in any hernia surgery, the crucial part is placing a mesh actually after closing, as I described, all the symptoms and the signs of umbilical hernia are due to the defect. This defect usually is closed with a suture, and then the weakened part, that is the umbilicus here, is reinforced with a prosthetic mesh. So it is the gold standard for any umbilical hernia surgery. So among the techniques I described previously, laparoscopy, that is sutureless or scarless repair of this umbilical hernia with a mesh reinforcement is the gold standard.
Dr. Suresh Kumar, what is the recovery time for umbilical hernia surgery?
So usually the patient will be discharged in a couple of days, in the very next day, or in certain circumstances 2 days after the day of surgery. So usually in people who does desk jobs, they can resume their activities in a week's time, or in patients who does strenuous activities which require lifting weights and all those things, we usually tell them to avoid lifting weights for at least 3 weeks of time.
Dr. Suresh, one common concern many people have is about physical activity. Can someone with an umbilical hernia continue to exercise safely?
So usually in an untreated patient but diagnosed with umbilical hernia, we usually tell the patients to avoid lifting heavy weights or per se doing any strenuous exercises, because in these patients, whenever you perform strenuous activities, these patients are at risk of developing any complications secondary to umbilical hernia. But in patients who do undergo surgery for umbilical hernia, we usually encourage them to do all the physical activities for that part, in lifting doing any strenuous activities or lifting heavy weights after 3 months from the day of surgery.
So, doctor, can an umbilical hernia recur after surgery?
So usually, traditionally, as per the literature, the recurrences are seen even after hernia surgery, but in the tune of 5 to 10%, depending on various factors. As I said, there are certain risk factors for any umbilical hernia. So if the patient continues to have those risk factors, that is obesity, so in this matter, we usually advise the patient for any weight loss treatment, so as to avoid any future complications. And also chronic cough, if the patient persists to have chronic cough or any prostate symptoms which involves increased abdominal pressure while passing urine and all those things, when these things are there, these patients are at risk of developing recurrences also. So usually we advise certain lifestyle modifications in these patients so as to decrease any recurrences rates.
Can you explain the lifestyle changes one need to make with an umbilical hernia?
So, as I said in the previous question, there is a certain lifestyle changes that are required to decrease any recurrences, if at all, in the future after surgery for umbilical hernia. These include all the precautions, weight loss, that is any obese patients who are at increased risk of recurrences after hernia surgeries should work out on weight loss. Second thing is chronic cough. So these patients who have history of chronic cough, that is asthma or any COPD conditions, should take necessary precautions to avoid this chronic cough. Third thing is avoiding constipation. These patients should be on high fiber diet and taking adequate oral liquids so as to avoid any future constipation episodes, and thereby increasing the risk of constipation. Fourth thing is to avoid to take all the treatment for any prosthetic symptoms, if at all, especially in elderly males. These patients are at risk of developing hernias elsewhere, if not at the umbilical region, elsewhere also. These lifestyle precautions should be taken so as to avoid any future complications apart from strengthening the core muscles. These includes all the exercises that should be done under supervision to increase the strength of the abdominal wall muscles per se. These lifestyle modifications help in decreasing the rate of any future recurrences.
So, doctor, can an umbilical hernia affect pregnancy?
So during pregnancy, these patients will tend to have prominent swelling. The swelling which was there usually before pregnancy also tends to become so much prominent, and also the chances of increased complications are also there during pregnancy, obviously due to raised intra-abdominal pressure. These patients are at risk of developing strangulation, what I have told previously, obstruction or incarceration or irreducibility. So these patients usually are treated conservatively during the course of pregnancy, and this is done with simple manuals such as supporting this umbilical hernia during any strenuous activities like coughing, the simple coughing and all those things, and encouraging the patient to wear certain abdomen support, external abdomen supports like abdomen belts and all those things. These patients can be managed conservatively during the course of pregnancy, and these are encouraged to undergo surgery for umbilical hernia after the pregnancy.
Dr. Suresh Kumar, what should someone do if their umbilical hernia suddenly becomes painful or swollen?
So certain signs in these patients with umbilical hernia denotes underlying complications. These include sudden increase in pain, sudden changes of skin over that swelling, or swelling suddenly becomes tender, that is painful on touch. These are the some symptoms of underlying complications. These could be these complications will range from simple irreducibility to a surgical emergency like obstruction and gangrene of the contents which have been herniated. So whenever patients see that there is sudden increase in swelling, sudden increased pain or sudden development of any skin changes, should raise suspicion of complications, and these patients should immediately take any doctor's help.
So, doctor, one final question. Are there any effective ways to prevent an umbilical hernia?
So as I told previously, all the risk factors such as obesity, chronic cough, constipation should be addressed in the first place. And secondly, there should be strengthening of the core muscles of the abdomen. This can be done under supervision and with certain exercises. These things help us in reducing the rates of occurrence of umbilical hernia. These are all the frequently asked questions regarding the umbilical hernia. If you have any further queries or doubts, you can contact us at Pace Hospital, High Tech City. I am Dr. Suresh Sevapuri, consultant surgical gastroenterologist and laparoscopic surgeon at Pace Hospital.
Dr. Suresh Kumar, thank you for sharing crucial information regarding the umbilical hernia to our listeners. I hope this information can be valuable for the listeners. And remember, your health is a priority, and addressing issues like umbilical hernia early can lead to better outcomes and improved quality of life. If you have any further questions regarding umbilical hernia, please don't hesitate to consult a gastroenterologist. Remember, umbilical hernia can be painful and uncomfortable, but with the right knowledge and treatment, they are manageable. We will see you soon on Pace Hospital's podcast with another episode. Until next time, take care of your abdominal health. Maintain a healthy weight, avoid heavy lifting without support, and don't ignore persistent belly button bulges or discomfort. Stay informed, stay proactive, and stay healthy. Thank you.